This is Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. On the show, you'll hear from innovators in the food space. We'll have disruptive conversations with people from around the globe who are taking the lead on topics like food sustainability, ending world hunger, food security, and so much more. I'm your host, Paul Newnham. In today's episode of Future Fork, I'm speaking to Sir David Nabarro. David has been at the forefront of global public health emergencies, working from the heart of the United Nations to drive forward solutions and outcomes that help deliver progress for the furthest behind. Amongst many other roles, he is also the founder and the strategic director at 4SD and one of my personal heroes. In our chat, we explored the pressing challenges and transformative solutions in global health and sustainable development. David talks about his influential role in shaping the Sustainable Development Goals, or the SDGs. We delved into the concept of critical dialogue and its pivotal role in fostering change and driving forward urgent action in the face of the global food crisis. Let's jump in. Sir David Nabarro, welcome to this show.
Hello, Paul. It's nice to be with you, and very, very good of you to think of incorporating me into the podcast series. I'm delighted.
Well, it's a pleasure. It's a pleasure. So I would love to take this conversation back to the beginning. How did your passion for the work that you do start?
I qualified as a medical doctor in 1974, and I was pretty certain that I was going to end up doing specialist medicine in hospitals in the UK. But shortly after I qualified, I met up with the chair of the board of Save the Children, whose son I'd known when I was at university. And he said to me, "Are you really sure that you want to just go down the well-trodden path? Just look at the situation we're in now. We need urgently medical officers to come and work for us in really tricky situations. And I've just been asked to provide an expedition that will go and work in the north of Iraq, because there's some people in extreme difficulty because of a war that's going on and the awful conditions they're under. And if you were free, I'd really like you to do that." And it was too much of a challenge to resist. So 2 weeks later, I was traveling to work for Save the Children with a small team in the north of Iraq, in a situation where there were several thousand, we don't know how many people, who were stuck in a corner because of war that was going on around them, and they were clearly not at all well and getting very malnourished. So I was part of a small group that worked with Kurdish doctors to try to find out what was going on with these people. And fairly quickly, I got stuck into the challenges they faced with keeping healthy and well-nourished, despite the impact of war. I was only going to be there for a couple of months, and then the conditions in the war zone deteriorated, and I got stuck, and I had to stay there for more than 6 months. It was very difficult. I was one of the last foreigners to be able to get out because the war really heated up, and it changed me forever. I thought, I'm realizing just how precarious the lives for really many hundreds of thousands, perhaps millions of people are, because of the conditions under which they live. And I decided, if I want to do public health for the good of people of the world, I need to focus on the combination of child health and malnutrition that seems to be such a major scourge for so many families and their children. And so that became my passion, and I've stayed working on that ever since in different parts of the world, and finding out about the intricacies of the relationship between the nutrition of young kids, their physical health, and then what happens in their households. And you realize that it's not easy to help kids get through that early stage of life if their conditions are very bad. But there are things you can do by working with the households, working with the local health services, working with those who produce and process food in order to really get better results for kids. And it was that notion of working on the interconnections between food, health and what happens in the household that became my passion, and that's been with me ever since.
It's amazing. And I'm sure there's huge stories and journeys all through that. It's amazing to hear how that was seeded and really grown in you.
Each story is a story of a life. So often when we're doing this kind of work, we deal with numbers of kids who are malnourished, numbers of people who can't access nutrition. But I think by being in very localized, often quite tricky situations, in the challenges of war with munitions being let off all around you and people in extreme fear, it really brings it vividly into your heart and into your head. And I think it's that move from studying what's going on in journal articles or in lecture theatres or in meetings around the world to actually being in households or in health centres and trying to help people with kids who are in real difficulty. That's a big shift.
There's so many areas we can talk on, and in preparing for this conversation, I was thoughtful on which ones to invest in with you. We want to talk a little bit about the Sustainable Development Goals. You played a role in the development of them, and we're very involved in that process. Can you maybe just tell us, for people that don't know yet what the SDGs are, how would you describe them?
There's always been interest since 2000 in trying to find focus issues around which those who provide aid can cluster in order to make life better for people. And in 2000, we had the first ever what were called Millennium Development Goals. There were 8 of them that helped to make sure that every different organization offering aid had the opportunity to align around the same issues. It had a huge impact, reducing poverty, improving infant survival, improving the survival of mothers as well, or increasing access to care for AIDS, tuberculosis, and malaria, or improving primary education. And that coming together around goals became something that all of us working in development got proud of. But by 2015, there was a slightly different feel to it. Instead of having goals that were focused on the needs of very poor people in very poor countries, the community that got together to discuss where to go next, that was 2012 in Rio de Janeiro, said, actually, we have to look at the whole world. We don't just look at the poor world, and we have to look at issues where the rich world also needs to make changes. And that became the basis of this 3 years of negotiation to get the Sustainable Development Agenda with its 17 incredibly interconnected goals that apply to the whole world. My role in that was as part of the Secretariat, the official system in the United Nations, and it was the member states, the representatives of the countries that were doing the negotiations. But something remarkable happened. Instead of there being a cacophony and massive disagreement, it was possible for representatives of 193 nations to coalesce around these goals and also to appreciate that actually when you're suffering in a poor environment, you don't have one area of suffering that is then needing attention and job done. In fact, you tend to suffer from a collection of challenges. You might have difficulty with having food. Your family might have difficulty with getting kids to school. There may be challenges with income, but there may also be challenges with accessing water. And in the end, what we tend to find is that it's a relatively similar group of households in any community that seem to be in difficulty on a number of fronts. And it was that notion of the interconnectedness that really came to the fore in the Sustainable Development Agenda.
And the role you played was at the UN level, working to bring
Yes,
it
at that time, I'd been working in a number of jobs for the head of the United Nations. I'd started with the World Health Organization and was sent to the UN headquarters in New York to help bring some health issues into the work of the UN Secretary General. My main focus was on avian influenza or bird flu. I also worked a bit on some other health challenges, including HIV, AIDS, and I was the WHO implant into UN headquarters in New York. That's very relevant because What we've tended to find in the international system is that issues can get stuck in different organizations and sort of left with them, whereas what you really need is to connect them all together. My particular focus on HIV AIDS in the era of 1987, 88, 89 was really about trying to help bring that subject so that it was not just in the hands of the health professionals, but so that it was being looked at as a much more interconnected, or what we call multi-sectoral issue. And I think that would be, if anybody was trying to say, what's Nabarro's contribution been, it would be to connect issues together across different sectors, because in real life, you don't just deal with the health people when you've got HIV AIDS. You don't just deal with the food people when you've got a malnourished child. You need others as well to work with you.
So building on that, that involves a dialogue. It's about bringing people together. So when you talk about dialogue and critical dialogues that need to happen, what are you talking about there, and why do you see that as critical?
Well, when I was doing this work in the World Health Organization and then in United Nations headquarters, one of the things that I noticed was the intensity with which people have disagreements when they're trying to work out how to tackle a challenge like malnutrition. You would get the food experts saying we've got to deal with the challenge by providing different kinds of food. You would have the health experts saying we need to deal with the challenge by treating illness. You might have the social development experts saying at the same time we've got to deal with the challenge by enabling women to have more time to look after their children when they're sick. And of course, they all matter. That was what I learned so profoundly in my 30s and 40s and then 50s in the United Nations and in other organizations, was that actually time invested in getting people in individual specialisms to work with each other has a very profound positive impact. It sounds bizarre. I'm sure people listening to this will think, well, surely that's what you do anyway. But I ask you, any listener, just to think what happens in your own life. Quite often you find that there are disputes on how to act in a particular situation, how to respond to a sick child, how to respond to a concerned mother, that bring in the perspective of the responder. And it sometimes needs quite a lot of care, even mediation, to get people to work across their divides. And so I've become one of these people who's rather committed to getting folk to talk to each other across what we call subject divides, or across what we call siloed divides in any aspect of human activity. And it's that capacity to bridge the divides through dialogue that's become my area of greatest interest. You see, Paul, here's the situation. If you've got in a community agricultural experts coming with suggestions for food to be grown, health experts coming with suggestions for treatment to be offered to malnourished children, social development experts coming to help women, particularly to find more time, and then people who are experts in weather coming to explain how climate change is affecting the seasonality and what happens in the fields and so on. Keeping those discussions separate doesn't really help people to find their way through challenges. And that's often the separation suits the service provider who may be being given money to offer a particular kind of service, whereas actually it doesn't suit the person who's suffering, who wants a kind of all-round comprehensive package. That's what I do now, is just simply to invest in bringing different groups together. I call it dialogue-based thinking, dialogue-based working, because I've found that if you can create the right conditions for people to talk without fear that they'll get somebody perhaps noting down what they say and coming and perhaps criticizing them. So if you can do it in a place without fear and you can facilitate and then mediate dialogues between people with different perspectives, you get better programs at the community level, but you also get better governance of programs at the headquarter level. And that's where I spend my time now.
That's really critical work. And I think, with some of the big challenges that we face as a planet, absolutely critical to be looking at how we address them in an integrated way. Most recently, we all know the world's facing multiple crises. There's been COVID, which I know you've played a key role in some of the response around. There's also the financial crisis, there's the food crisis, there's all of these crises. I know recently the United Nations Secretary General asked you to lead on the Global Crisis Response Group. Talk to me a bit about the global crisis that in the way that you see we're facing it at the moment.
If we go out from where we are now in London and we wander into different communities around this city, it won't take us long before we find people whose lives are just really unpredictable and difficult. And they are people who are, in my language, experiencing crisis conditions. They may not know where they're going to get their next meal from. They may have difficulty with chronic illness, or they may not have anywhere to live. You see them living on the street in London. And my point would be to you, for those people, crisis conditions are here and now. There are people living in crisis in many, many countries of our world. Obviously, there's more people affected by crisis in places that are also affected by climate change or by conflict or by disease. But remember that there are crisis conditions for some people everywhere. And that's been my main point that I've sought to convey when working with those who are wondering about the future of our world and her people. I've said, just remember, poor people experience very difficult conditions, especially when there are unexpected things like a disease epidemic or there's climate change happening. The second thing that I've noticed is that as well as crisis conditions being everywhere, for some people, crisis conditions are just getting more and more pronounced. These are people who live in places affected by climate change, who live in places that are affected by use of violence to try to resolve conflict. There are people who live in places where there's been nasty disease outbreaks like cholera going on in many places right now. And for them, life's getting much nastier. In particular, it's the people who are poorer, the people who come from single-parent households, the people who perhaps have lost land or access to essentials for doing their agriculture, like water, because of drought, and they are getting a much worse time. By and large, it is the poorer people in the world's poorer countries who are in particular difficulty. And because we have seen over the last 10 years that for some of these crisis conditions are just continuous. There is drought after drought after drought, plus there may be war going on, plus there may be also difficulties with accessing essentials for producing food, that it creates a situation that I now call perma-crisis. I'm not the only one. There is perma-crisis for poor people in world's poor nations. It's not getting better because these nations are finding it super hard to get extra cash if they want to borrow it from banks. It's also kind of tricky because many of these nations are experiencing conflict and there's no global police force coming in to rescue. Might have been like that some decades ago. But right now there are a lot of festering or even exploding conflicts all over the world that are affecting civilians, particularly women and children, because the rules of war have changed in the last few years. And so increasing use of violence to try to resolve ongoing conflicts is just a global epidemic right now. And people find it very hard to keep their children well nourished and to have them clean and accessing drinking water and so on, if at the same time they are being exposed to violence and particularly to bombing and being forced to move and so on. You can't bring up a child in any kind of security in that situation. And so this epidemic of violence on top of increased cost of living for poor people is really a big contributor to the perma-crisis.
Given the perma-crisis, what is needed in terms of a response to this? What should we be thinking about to drive forward urgent change? Obviously, in the past, we've had models that we've used. You were involved in the 2008 food crisis. There's been plans that have been built. Is there something different that we need to be thinking about in this current time that we find ourselves?
I've been very lucky. I've been working in international issues through a period of unprecedented global solidarity around what needs to be done. Looking at the Millennium Development Goals that were released in 2000, that was a brilliant agenda for tackling the challenges that most face poor people. And as mentioned before, there was a dramatic reduction in poverty and indeed some reduction in hunger during that period. It was a time when the needs of poor people were very much front and center in the thinking of world leaders. And that built up even more strongly once the Sustainable Development Goals had been negotiated. About 5 years into the SDG period, so I'm talking really about 2020 onwards, things started to unravel in our world. Firstly, we had COVID-19. Some people would say, well, it was not a very lethal illness and the world recovered quite quickly. I don't agree with that. There's been over 7 million people who are documented to have died as a result of COVID. And it lasted as a public health emergency for more than 3 years. And it led to all sorts of decisions being made that had direct impact on the well-being of poor people, particularly movement restrictions and in some cases lockdowns. And the result, in addition, was a sense that the wealthy nations were fundamentally looking after themselves and getting access to vaccines and other essential goodies. And poorer nations were being invited a bit to fend for themselves. What was a bit frustrating was that the world had recognized that mechanisms would be needed to ensure equity, particularly on things like COVID vaccines at the beginning of 2021. But despite all the advanced work, when it actually came down to it, the wealthy nations needed to get as much vaccine as they possibly could for political reasons. And the result was a real sense in our world of the rich countries looking after themselves and their interests, perhaps at the expense of the well-being of poor countries. Now, that came 5 years after this amazing Sustainable Development Agenda. And I think it led to a recognition among many hundreds of leaders in what we sometimes call the Global South, that whilst when in times of plenty, there's a real effort to distribute foreign overseas development assistance and so on, when things get tough, it's much harder. So we had a combination of 2020 COVID and then 2022 war breaking out in the east of Europe, the war in Ukraine, and it all had a compounding impact on the ability of poor countries to be able to access the things that they needed for their people. It was the beginning of a fracture in what I call the global consensus of looking after the needs of poorer people. And the result is one that we're still having to live with. There's reductions in development assistance. There's apparently quite a lot of reductions also in the willingness of wealthy nations to be increasing their support for poor nations. And there are, in addition, as I say, this increasing number of conflicts going on all over the world that actually make responding to need so hard. So in the space of really about, if we go from 2015 onwards, about 8 years since the Sustainable Development Agenda was agreed, the consensus that actually the world of the future is one where equity predominates, where there is fairness, that sense has slightly diminished in recent years. And some of the more recent wars have added to that sense that not everybody is playing by the same basic principles. And so the new imperative is to focus on those people in our world who are less well supported than we are, and not at all to be cutting foreign assistance or cutting development partnerships, and instead to be trying to find ways to actually increase the capacity of poor people, poor nations to have agency and to be able to look after themselves. Now, I want to stress this shift that I think we're seeing, a sort of cutback in general commitment to development assistance, to reducing poverty, reducing malnutrition, and so on. It's not necessarily an irreversible shift, because that same basic commitment to equity is still there. But it's because the context, particularly of the wars that are going on right now, is making it super hard to get countries to work together for collective outcomes.
So given this in the next 5 years with the SDGs, what's critical for us to focus on? What should we be really putting our shoulder to?
You see, I am a public health doctor first and foremost. I want to see the same opportunities, the same survival chances, the same educational achievements for all people from all different parts of the world. I know it sounds idealistic, but it's how I've always been brought up. Every single life has the same value, and it is important to treat everybody as though they've got the same value. There's no notion that there are some people whose lives are worth more than others. And right now, those of us who think this and are prepared to speak out about it are finding ourselves in a space where not everybody is willing to agree with us. And in fact, there are some who are quite explicit, saying, no, it's not like that. There are some who should be preferred. There are some who perhaps are more deserving. And it's that shift away from the notion that every human life has value, that everyone has a right to food, a right to shelter, a right to water, to a situation where we perhaps tacitly are accepting kind of constant structural inequity. That's the disturbing thing. That's why your work is so important right now, because you are challenging a trend that seems to be occurring that's taking us away from all the great things that were achieved during the negotiation of the Sustainable Development Agenda. So it is doing what you do, what I do, but doing it so much more strongly, so much more energetically, because there does seem to be quite a major shift in our world towards people and nations saying, we'll look after ourselves first, we'll look after the total of humanity second. And that will lead to bigger splits between those who have wealth and those who have poverty. It means that the poorer people in our world are destined to permanent perma-crisis, linked to climate change, linked to warfare, linked indeed to economic misery. And even though it's not very nice to be talking about, not very nice to be focusing on, it needs our attention constantly.
I think this is a key message for us to continue to push, this equality, this leaving no one behind. And I think that was something built into the SDGs. It was built in, this term of leave no one behind, and it implies no one, not some people.
Absolutely no one. Really important. One of the things I think we've learnt is that it was quite easy for people when the Sustainable Development Agenda was kind of agreed in September 2015. It was easy for certain leaders to give lip service to it. But when it actually comes to checking that there really is equity and that that is being pursued, to shift from that lip service to real service, it's more difficult. And so, the second part of the role that I believe you and your colleagues have is one of calling those leaders to account, not in any kind of aggressive or challenging way, because every leader will explain that they've got constraints on money in the bank and all that stuff. And so instead of doing it in a way that's too challenging, just simply, we recognize that you've got problems. We recognize that your funding is tight. We recognize that you're having to deal with violence and that's making development very difficult. But let's think of those who are at the wrong end of it. Let's think of the children who, honestly, they have no choice. A child who is living in a place that's being under bombardment, that child doesn't choose to be in the place that's under bombardment. So we need to just continue to make these points super strongly without relenting, but at the same time in ways that engage with leaders rather than just simply vilify them. That doesn't help anybody.
So despite kind of the weight of this discussion that we've just had, we talk a lot on this show about food and the right to food, to access, to affordability. And one of the things that I really like to kind of ask people, and this is maybe a little more personal back to where we kind of started, but is there foods that bring you joy at the moment when you eat them? And maybe it's eating them with someone, it's eating them, they bring back a memory, but what's something that brings you joy that involves food?
I am one of these people who really enjoys cooking, who enjoys meals, and who enjoys relaxing after eating with locally prepared, produced food, if I can get hold of it, going to markets and buying stuff, but sometimes encountering producers, farmers and like, and buying direct from them. And because I'm so lucky, I'm able to do this, and my health is really remarkably good. I've tailored it a bit because I think when I was younger, I probably didn't look after it as well as I should. But what a luxury we have. And I suppose that then contrasts with the communities that I've been working with over the years who really don't have that luxury of choice. They don't have the luxury of refrigerators so they can keep stuff cool and fresh. They don't have the luxury of being able to access clean water and other fluids and just being able to get them whenever they need them. It's a huge difference between my food experience and the food experience of people who are less well off. But my food experience is so central to me. And the more I meet people who remind me of the central importance of food in their culture, the more I realize the centrality of our work around food security and nutrition for people's cultural well-being and sense of self. So let's just all of us remember that those of us who love our food are really privileged, and we do need to create space that those who love food but are just not able to practice that love have a better chance to do it. Everywhere I go, I find that even when people have virtually no food in their homes, if there's a visitor who comes, there is something special done. An egg might be cooked, or even a chicken might be served. And you feel awful sometimes that people who are really poor are making these special effort for you, but they really want to because they're welcoming you and they're valuing you. So let's all remember that for everybody in the world, being able to offer a decent meal to somebody is such an important sign of respect and love.
Thank you for joining us, David.
Okay.
You've been listening to Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. Future Fork is produced by Disruptive Consulting Solutions and supports the SDG2 Advocacy Hub. For more info, head to the website futureforkpodcast.com. This show was produced with strategy and production support from Wavelength Creative. So you don't miss an episode of Future Fork, make sure to subscribe to or follow the show in your podcast app. And while you're there, leave us a 5-star review. It really helps others find the show. I'm Paul Newnham, and I'll see you in the next episode.